Good morning, everyone. Thank you for joining us. I'm Regina Brown-Wilson, the Executive Director of California Black Media, and I am co-sponsoring today's briefing with Ethnic Media Services. Today, you're going to be hearing from physicians from around the state who will be sharing information on the updated COVID-19 boosters. Today, you'll hear from Dr. Maggie Park, County Park Public Health Officer, San Joaquin County Public Health Services, and Dr. Eva Smith, Medical Director of Kama Medical Center on the Hoopa Reservation in California. I want to thank you for taking the time to come and speak to ethnic media today, to give them the vital information that they need to write about this important topic. Thank you so much. We'll go over to Dr. Eva Smith, who's Medical Officer with the Kama Medical Center in Hoopa, California. Dr. Eva Smith will offer the perspective about COVID and boosters on the Hoopa Reservation, which she serves. She'll also share the message as she feels will resonate about the new updated booster. Dr. Smith?
Thanks. I'm speaking from the Shinnecock Reservation in New York, which is my home community. I've been a physician for more than 40 years, both in family medicine, addiction medicine, and preventive medicine, and currently working and have been for 25 years working on my husband's reservation in California on the Hoopa Valley Reservation. So I kind of look at the whole episode of what we've been living through as a journey, and I regularly use this term in our clinic system, talking about our journey through COVID land, from when we were scared to death in the beginning, didn't know what all this was meaning. I'm old enough to have been through kind of new medical challenges that have come to us, when I didn't know what HIV was going to mean, when doctor called me in 1982 and said, hey, your patient had a blood transfusion and we're not sure what this means, but this is what I need you to do, and have lived through other kind of conditions like that. So I looked at this as yet a new challenge, and what can we do to protect our very vulnerable community? It's a small community in a very rural, remote area. You have to go through twisty, windy roads to get there. Weather impacts us all the time. Currently dealing with forest fires, smoke, air quality issues. And so when we first got the vaccine, the elders turned out. I was so impressed. They lined up. They wanted it. They didn't want to die. They were watching on TV what had happened in other Native communities with really horrible, horrible death rates. This was a community that took a lot of leadership in the beginning. We went into lockdown mode in March of 2020, and just said nobody can come in from the outside. They were very, very protective. And so we didn't actually have our first COVID case, not death, first case until July of 2020. Had a little bit of spike, then went down for a little bit and up and down since then. As the public health officer, I daily, unfortunately, monitor these numbers very carefully and closely. We've been through several spikes. We thought we were past one and maybe ahead of the curve of what was happening in our outer counties. And then we had another spike that we fortunately think we're now coming down. There was a lot of hesitancy among younger people. Again, the elders were impressive. They turned out, they lined up, they wanted it. But the next middle-age group was a little bit more forthright about coming forward. And then among the younger group, I think I like the terms that describe the C's of the confidence level. There was complacency and there was convenience. And we were really challenged of how do we make this easily accessible? We are a small tribal clinic trying to deal with a lot of acute and chronic disease issues, and then to take that same small, understaffed, underfunded clinic system and say, okay, now you have to evolve this whole preventive approach of how you're going to get clinics in the community, how you're going to offer testing, how you're now going to offer the evolution of different treatments, antivirals that are available that we are now able to offer, and very thankful for that. But that we're dealing with complacency. We're dealing with people being tired of having a shot, tired, honestly, of the inconvenience of yes, I'm going to be sore for a couple of days. And I'm regularly saying, I'd rather be mild, flu-y kind of symptoms for a day or two than to be sick. I want to live. I have children. I have grandchildren. I live in a extended family system, bi-coastal, both my community here in New York and obviously where my husband's family is and my children are living and being raised, and have a responsibility as an elder to be there to take care of my kids and my grandkids. And so I'm going to do what it takes, whether it's getting a flu vaccine or getting a couple of different COVID vaccines. I've had the initial 2 primary series. I then got 1 booster, and then the next booster came out. I was right there in line to get my other booster, and will be there in line also when this becomes available to our community within the next several days, and do our best to communicate how important it is. We have limited resources, and so to deal with the preventive side and then take care of any additional extra source of what comes to us that is a challenge. We had our first hospitalization in several months just this past week. Elder that had been boosted, elder that had lots and lots of vulnerabilities. But this variant, honestly, I see is making people sicker. I work regularly COVID clinic, not just from a public health standpoint and not just as medical director, but I'm frontline working with who's coming through the door, whose extended family system is connected, know the vulnerabilities of so many patients with diabetes, with weight issues, with rheumatoid conditions, with cardiac conditions. I mentioned the forest fire smoke. It's really hard this time of year to tell. Do you have the sniffles because the smoke is bothering you? You can't breathe good because you've got asthma that's been triggered by all this forest fire smoke, or do I have COVID? So regularly encouraging people, test. Come in, we will test you. If you're eligible, we will offer the treatment immediately. But most critically, offer the preventive vaccine. That's what's made the big difference, I think, in our having as few deaths as we've had, because we continue to support the message of how critical vaccines are. I truly believe that we are seeing sicker people with the Omicron BA.4 and the BA.5 than what we did a couple of months back. And so anything that's going to offer an improvement in condition for the community. We live in large extended family systems, multi-generational households, and there's a real respect for the fact that if you get sick, there's a good chance you're going to be around somebody that's sick. I had a young man come into the office the other day who was vaccinated and was expressing his irritation with other people that weren't so anxious to step up and get the vaccine. He has a daughter that's 4 years old that's had a liver transplant. He has a mother with certain health conditions. And so he's very, very expressive about, we need to make sure people go out there and get their vaccine. Because it's not just about me, it's about we. It's about our whole community. And we as Native people taking care of one another. The vaccination is one more tool that we have that we highly encourage people to use.
Thank you so much, Dr. Smith, for that. I know that we're like 2 minutes ahead of time, but this gives us an opportunity to, tee this time up for questions in the chat. And let me tell you, there have been plenty of them. And so I'm actually going through them right now so that I can make sense of all the ones that we got and get to some of the questions that we didn't get to. But Dr. Smith, since you just finished, there's a question here for you from Frank Blanket from FNX TV. Is there a correlation between elders and Native youth as it pertains to deciding to move forward with vaccinations or deciding not to get it? Do you think one group sways the other group in either direction?
It didn't happen as much as I thought it would. Definitely within Native communities, there is a respect for elders that I was repeatedly saying to folks, look, the elders lined up. Why aren't you lining up? Why aren't you listening to grandma? So there's a disconnect that I don't quite understand. There's a frustration as a clinician to have a preventive tool available that not everybody's choosing to take, and trying to calmly understand that, respect that, and offer the education of this is what we know right now. We have been through this pandemic, now endemic phase, long enough to understand that, yes, there are risks, but we believe in our experiences with the vaccine to date that the benefit clearly outweighs the risk. And yes, as one of the other speakers referenced of, yes, my cousin had it and they're fine, so, I'm not worried about it. So what if I get it? It's not a big deal. It is a big deal. You as an individual may not be so effective, but you live in a community of very vulnerable people all around you. I just had a sister-in-law that is a dialysis patient that we were so protective and made sure she got all the boosters and had everybody run around the house with a mask on. And unfortunately, she just got it. I believe she is doing as well as she did because she had the prior vaccine in her system, because she was able to get medication of the new antivirals to support her and go on to get antibodies and EvuShield and some of the other tools. So the correlation of this is what grandma says to do and you need to do it doesn't necessarily follow in our experience so far with COVID.
Thank you so much for that. This is my own editorial. I think that's what happens whenever you tell somebody to get shots. So maybe it works whenever you say clean your room or go do something like that, or take out the trash. But when you say go get shots, they freeze up.
There is the issue I wanted to reference, though. So there were a couple of elders, very respected individuals in the community, very traditional family members that were absolutely positively against the vaccine. And they would come and talk to me about it and say, yes, I know you think I should get it, Dr. Smith, but I'm scared. I'm not going to get it. It's too new. They don't understand it. And then unfortunately, in that particular family system, there were several members that became extremely ill with lengthy hospitalizations. Fortunately, they are still alive, some of them dealing with long COVID at this point. And those two elder sisters marched into my office one day and said, I'm ready. I'm going to do it. And I'm going to tell every single one of my nieces and nephews and grandkids to go get it. So we use the power of that family system as well. When that clock turns and the switch happens, they were the full force people to say, let's do it. Stop messing around. This is a serious, serious illness, and it's not going to take us down.
Yes, thank you. And so now we're going to turn to Dr. Maggie Park, who's the County Public Health Officer for the San Joaquin County Public Health Services. Dr. Park, go ahead.
Thank you so much. Lovely to be here with you all today. I want to say that the rollout of this new booster is actually quite timely, as many models are predicting that we're facing another COVID-19 surge this fall or winter, and we need to be ready. The bivalent vaccines were developed to trigger an immune response to the Omicron BA4 and BA5 lineages, and those are the viruses that are currently still causing the most COVID cases. BA.5 has been the predominant circulating variant since July and is still, and now accounts for about 87% of all newly diagnosed cases of COVID, with BA.4 pretty much accounting for the rest. Here in San Joaquin County, as in other parts of the state, we saw significant uptick in hospitalizations with the introduction of BA.5. In California, 72% of all people are now vaccinated with a primary series. That's nearly 29 million people who have received their first set of shots, usually 2 doses of Pfizer or 2 doses of Moderna. And that's great. But only 58.8% of Californians who are eligible for a booster have been boosted. That number is even smaller in my county, San Joaquin, where we have a 48.5% booster rate. So those of us in public health and in the medical field have to wonder why so many people were willing to get the first 2 shots, but then not more. Last year, with the introduction of the original boosters, the public health department here in San Joaquin tried to gather information to understand why people were feeling hesitant. We asked our community business organizations what they were hearing from their clients, We polled people such as African American local leaders who we gathered at a town hall meeting. And we continue to monitor responses to our social media posts to get a sense of what people in the community are thinking. So one thing that I think is going on right now, which might be a barrier, is that people think COVID is over. But this virus is not going away just because we want it to. It's evolving. It's actually becoming more highly transmissible and getting smarter about evading our immunity, whether that's natural immunity from prior infection or immunity from vaccination. So we have to try to stay a step ahead of it. We've used data science to try to educate the public. What we do is we show them curves, graphs of our past waves of COVID and our predictions for future waves. And our own data scientist has gone out on many town hall meetings and is willing and able to do webinars where he speaks very eloquently and can explain how COVID is not over. Another thing that we hear a lot is that the vaccines aren't safe. This is still misinformation that's being perpetuated in our communities. But with all the millions of doses that have been given in the United States and around the world today, we have so much information about them. And we do know that they're safe. And we know that these newest bivalent vaccines are built on the same technology of their proven predecessors. In fact, when it comes to bivalent vaccines, an earlier version of the bivalent vaccine that contained the BA.1 Omicron underwent a clinical trial in humans and showed that people did have either the same amount of side effects or perhaps even less. Things like redness, swelling, pain at the site of injection. Another thing that we're still hearing is that shots don't work. People saying, my friend is fully vaccinated and boosted, but she still got COVID. And to that I say yes, but is she still alive? And yes, of course she is. We never promised that the vaccinations would mean you wouldn't get COVID. We just said that it would reduce the severity of your disease and your chances for requiring hospitalization. Yes, the chance of getting COVID is also decreased with vaccination. And all of this data is closely monitored by CDPH and posted on the state's website. We've collected a lot of data and we can literally graph the difference that it makes to be vaccinated. So definitely what we know is that your chance of getting COVID decreases with vaccines, but the decrease is even greater when it comes to your chance of being hospitalized or dying. Another thing that we are trying to combat is COVID fatigue. So many people who are just tired of thinking about COVID want to move on. They're tired of considering whether they need to get more shots. Perhaps they're confused as to whether they should. Maybe they got some shots to begin with, the 2 doses, maybe a booster, but they don't want to keep going because they seem to think that there's just no end to all this vaccination. And to that, I tell people the majority of folks in the United States get a flu shot every year. And here we are less than 3 years in the pandemic and we're already tired. So hopefully we get to a point where the COVID shot is an annual thing like the flu shot. But in the meantime, we need to be patient and need to protect ourselves. So, lastly, I want to say people just don't think they have the time or the means to get vaccinated. And to that, I do want to reiterate something that I've said before. Don't wait. We don't wait until we have pain to go to the dentist. So why would you wait until you're in the hospital to ask for a vaccine? We have tried to take the vaccine to people in San Joaquin County to make it convenient to them. We continually tell them that it's free. When it came to farm workers, we reached out to their owners and managers, organized times that we could go to farms and plants and vaccinate people. We've taken vaccines to homebound people with a small traveling team. We've taken them to homeless shelters. We're doing vaccine events at our WIC locations. We've really promoted them in our Latinx and African American churches. And now with boosters, again, we're making them available in the county. We have a press release out today that's going to tell people that they can get on our website, sjready.org, and find when we're vaccinating and where. We have a mobile van unit, and all of our community business organizations know that they can ask for the van on any particular date, and we will be there with the bivalents. For example, one of our churches is having an event on the 18th, and their flyers already out advertising the fact that they will have the bivalents. In fact, I'll just say that we were also starting to take the bivalent vaccine into jails. We go to jails to do syphilis testing, and we've started to do some monkeypox vaccines. So we just decided we're going to tack on the bivalents as well. So as much as we can, we're trying to get it out there. And for anyone who's looking, it should be available across the state. And vaccine availability will be increasing over time. Thank you.
Well, thank you so much, Dr. Park. I do want to make sure I just do another housekeeping. When we are speaking, we do have interpreters who are translating. Let me make sure I'm talking slow enough for them. They're translating, I believe, in Mandarin, Spanish, and Korean. And so thank you so much, Dr. Park. We're going to take questions. A previous flu shot isn't required for flu shot. So why are people having to complete a series required for one to get the new COVID booster? Isn't just having the booster without previous COVID shot better than having none at all?
Yeah, so this is true. The flu shot we change every year based on what's going on in this other hemisphere and based on predictions. And as Dr. Brooks said, it is often 3 or 4 variants in it. And yes, you don't have to worry about what you received in the prior years. But with COVID, the reason why these new bivalents are only available to people who had a primary series with the original monovalents is it's in the word, really it's self-explanatory. They are boosters. So they're meant to boost an immune system that's already received some vaccination and has some recognition of those spike proteins. So the expectation is that you get a primary series first of Moderna or Pfizer, which are higher doses for each of those. You get 2 doses of Pfizer 30 plus 30 micrograms or Moderna 100 plus 100. And then the booster in the bivalent is less. It's half of the original, half of the new strains. So really you want to get that primary series taken care of first, get your body to have some recognition in its immune response, and then the boosting vaccine is additive to that. And it is a smaller dose. You need to get larger doses first.
And I don't know if we did this. I know we're going to be wrapping up here shortly on the questions, but this probably is the last question. Did we even explain or did the definition of the bivalent? What does it mean? For anybody who may not know.
It's basically a vaccine that's a combo. It's got some of the original strain of the coronavirus, and then it's got the BA.4, BA.5 Omicron strains in it.
Okay, well, great. Well, thank you so much. Any other questions that are, or maybe we have one more question, because I actually took Polaxlovid, so I want to actually ask this question really, really quick. But many people cannot take Plavacid because of contradictions with their medications they may be taking, or health conditions. So maybe that wasn't a question. Maybe that was a statement. Was that a statement, Sunita? Maybe you were using that as a statement versus a question. Yeah. Okay. So it was a statement, not a question. All right. Okay. Great. Well, you know what? I want to thank everybody for joining us today. I also want to take the time just really quick to segue and thank Sandy Close, the founder of Ethnic Media Services, who does a remarkable job and puts a remarkable amount of time into ensuring that we have these wonderful briefings and bring experts with different perspectives to be able to ask these questions. So Sandy, kudos and thank you. And to all the speakers, we'll do this as a wrap up kind of 45 seconds that you may take to answer this, but final question is, what's the most important message that you would tell your patients this afternoon or anybody you're going to see at the next church or mobile clinic about the new and updated booster?
So I can start. The biggest question I always get from people around me is, are you going to get it? And the simple answer is, yes, I do plan on getting the bivalent. And I want to address questions from Nancy and Elena in the chat that I don't think we got to real quickly, because there is confusion. And I do see another person putting in the chat about how there's vaccine overload. So there's a lot of confusion. And so another point I want to make is, we are no longer really counting your booster doses. I know that that's been so confusing. People 50 and over could get 2, and immunocompromised could get 3, and now everyone can get a 3rd or a 4th, and now the 12-year-olds can get it too. And so what the CDC is saying is, we're moving away from all the confusion of saying 2nd booster, 3rd booster, and what we're saying is anyone who got their last shot, whether it was a primary series or your first or second booster is now eligible for this bivalent vaccine as long as they're over 12 and it's been 2 months from that last shot. And so that could be a fifth, it could be a sixth for some people. I think it's gotten to the point where we're not going to say fifth, sixth shots anymore. Just wanted to make it clear to people that if you've got a booster in the past, as long as it's been 2 months from your last one, you can get this one. The definition of fully vaccinated used to be the first 2 doses, and then we said up to date if you had the first 2 doses plus booster. Now really we're saying be up to date as much as possible. And yes, you can get that booster, but it's approved as a single booster dose. So no, Elena, you can't keep going every 2 months and get another bivalent, another bivalent, another bivalent. It's one single bivalent booster dose that's been approved at this point. Thank you.
Thanks.
I wanted to mention that we're about to go inside. I think our perception is that the current BA4 and 5 are more contagious than some of the previous variants. And so as we move inside from the summer months to everybody being in small closed homes, that the infectious potential is so much greater. So the opportunity to get the vaccine now to prevent what we think is coming down the pike, and why the timing of this is so critical for something that is safe and that is preventive, is something that we really need to promote. That summer's over and the rains are going to come, or whatever kind of storm. Hopefully we'll get some rain. But life is going to move inside with less outdoor activity, and that puts us all at much greater risk.
And if you all have nothing else, I want to thank you all for attending today. Thank you for your time.
Thank you.